As we switch gears at 10:10 right now, back to health news. Right now, we want to shine a spotlight on a rare endocrine disorder that affects thousands of Americans but goes often undiagnosed. Endocrinologist Dr. Alan Krasner joining us this morning along with patient Tony. Good morning, gentlemen. Thanks for joining us here on Live Impact News.
Good morning.
What is this disorder, doctor? And explain, the history on this.
So acromegaly is a rare but serious disease. It's caused by a benign tumor that forms in the pituitary gland. And this tumor makes too much growth hormone. Too much growth hormone over time causes slow changes in the appearance of the face. It causes enlargement of the hands and the feet. And it also causes damage to internal organs, including the heart and the joints of the body. This disease progresses so slowly that healthcare providers and even the patients themselves may not realize these things are happening. So unfortunately, there is often long delays in making this diagnosis, and this leads to delays in starting necessary treatment.
It could take up to about 8 years. That is a long time. Why does it take so long for people to realize what they're going through?
Well, it is because of the slow nature of the changes that occur both in the external appearance of the body, but also in the internal organ damage. For example, there are some characteristic changes in the facial appearance that occur in this disease, including enlargement of the jaw, for example. But even the patients themselves don't see it happening. It happens so slowly. And actually, one of the best ways to make this diagnosis in clinic for a physician is to ask to see a picture of the patient from 5-10 years ago. And oftentimes, when you see the changes that have occurred over that period of time, you can pretty much establish this diagnosis.
Let me bring in patient Tony because Tony had this diagnosis. When did you notice something wasn't right, and what was your journey like?
Thanks for asking. Well, I noticed around 2015, my journey with acromegaly started when my shoes began to fit tight, my ring fit tight, I had constant pain in my hips. And I didn't realize that those were signs for something bigger. I had an appointment with my primary care physician back then and about the ongoing pain, and he ordered some tests. The results of those tests led to my diagnosis of acromegaly.
And so how have you been living with it now?
Well, living with it now has changed a lot about my day-to-day life. Physically, I've had constant joint pain and fatigue, enlarged hands and feet. Emotionally, I've learned to give myself grace. I found a great support system, and I've encouraged other people to give themselves grace as well and be able to live with acromegaly.
Well, really, that's such a lesson for anything in our daily lives and all the challenges is right. It's just giving yourself some grace. Doctor, if this goes diagnosed, what treatment options are there?
Well, it's usually treated first with an attempt to surgically remove the pituitary tumor that causes this disease, and that works usually about half the time if an experienced surgeon is doing the procedure. Medications, though, are required for those who do not go into remission after surgery. Historically, these medications often require monthly doctor visits for deep, painful injections. New medications have come out, though, and there are more on the way to help these patients live their lives and spend less time treating their disease. I'm here with Crinetics Pharmaceuticals, really working hard to raise awareness of this condition because it is very important and needs to be promptly recognized and treated.
Absolutely. So the impact that viewers can have after watching this and advocating for themselves if they feel something is wrong, doctor, what would you say to those people?
Well, the first step is to talk to your healthcare provider. And I would also encourage you to consult acromegalyreality.com for a lot of good information.
All right. And Tony, thank you for sharing your journey as well and your message to viewers out there.
My message would be to give yourself grace, to understand that you're not alone, that there are a lot of us who are going through this, and that we together actually can grow and live a healthy life while having acromegaly.
All right, gentlemen, Dr. Tony, thank you for joining us and helping us become and learn a little bit more about this life-changing disorder. Thank you for sharing the information this morning.